Now I'm going to go straight to Steve Barclay now, the Health Secretary and Conservative MP for the North East Cambridgeshire region. Steve, lovely to see you. Thanks for joining me on today's show. Look, can we have a quick word on France?
Good morning.
Obviously, there are still riots going on across the Channel. Is it a safe country to return migrants to?
Yes, it is. I mean, the Foreign Office will be closely monitoring the situation in France. For anyone proposing to travel there and with any concerns should just follow the guidance that will be on the FCO website. So they will be keeping a close eye on proceedings and keeping that guidance regularly updated.
Are you worried about the cost of the Rwanda scheme, £169,000 apparently to send a migrant to Rwanda? Meanwhile, you've got doctors and nurses striking over pay.
Well, the cost needs to be looked in the round in terms of the deterrence effect as well. What the assessment suggests is if nothing was done, the cost could escalate as high as £11 billion. So it's important that we do act. That is why we put in place the legislation to take action on this. I think people are very clear. When I speak to them, they want the boat stopped. That's why the Prime Minister made it one of his 5 key priorities. And that is what we're doing. Now, the High Court supported the government on this. The Lord Chief Justice supported the government in the Court of Appeal, but 2 other judges didn't. Now, we respect the court. We've got the best judiciary in the world in the UK. We respect their decision, but we do think that this now should go to the Supreme Court. And it's right we take action to stop the boats. That is what we're determined to do. The Prime Minister has made it a key priority, and that's what we're working on.
But the Rwanda plan isn't working yet, is it? Because nobody's been deported there. So the boats aren't being stopped. They're still coming. Debt is now 100% of GDP. Inflation's almost 9%. NHS waiting lists remain eye-wateringly high. Which of the government's 5 promises made by the PM in January will it actually keep by the end of the year?
Well, the Rwanda policy isn't the only aspect of stopping the boats. There's things like the returns deal with Albania, which has had a dramatic effect in reducing the number of Albanians coming across on small boats. But we do think it's important in terms of deterrence. That's why the deal has been reached. We're going to test that now in the Supreme Court. As I say, the High Court supported the government on it. And I think your viewers want the government to take action. That is what we're doing. We're doing so in a way that clearly complies with the legal process, but it's important we now take this to the Supreme Court. The Prime Minister, the Home Secretary are determined to stop the boats, and if we don't, then there'd be a huge cost. And of course, Labour have no plan at all in terms of stopping the boats. Keir Starmer has no proposals to do so.
That may be a fair point, but Rishi Sunak has come up with this 5-point plan of deliverables, and he can't deliver them.
Well, we're making progress if we look at the one that sits with me, Camilla, in terms of waiting times. We had a plan to address the longest waits, the 2-year waits last summer. We virtually eliminated those. Our next target was to address the 18-month waits. We got those, over 90% of those cleared by the end of March. We would have cleared them but for the industrial action, but we made huge progress.
Do you mean 18 months
with
or
the
18
performance
weeks?
of the NHS. 18 months at the end of March. We cleared those over 90% of the 18-month waits by the end of March.
18 months
and if you contrast that with Labour's performance, of course it is, but if you contrast that with the performance of the NHS in Wales, where it's run by the Labour government, there's over 70,000 people waiting more than 18 months at the end of March, and that's with a population 18 times smaller than that of England. So the point is we have a plan, we're working through that.
Yeah, but the NHS target for waiting or being treated within 18 weeks is 92%. Currently, only 58% are being treated within 18 weeks. So you're failing miserably on that target.
Well, we had, as viewers know, a pandemic. That has created huge backlogs. That is what is taking time to work through. We're innovating in doing so. Things like patient choice. The Patients Association say giving patients choice to go to shorter waits in other hospitals, making that decision easier. About 76% of patients are willing to travel a little if it reduces their time. Now, the Patients Association says that will reduce times by around 3 months. We're looking at the independent independent sector. There's capacity that we can better use within the independent sector, so making that available. We're fast-tracking things like our community diagnostics centres. We've got 108 now open. They've delivered 4 million more tests and scans. We're planning to do 160 in all. And we're also looking at how we get treatment to people quicker, so 43 new or expanded surgical hubs. So we're investing over £5 billion in our capital programme on electives, looking at how we get more of those diagnostic centres in place, the surgical hubs open, and that in turn is bringing the backlogs down. But it does take time. That's why we focus first on the longest waits. And if you look at the progress we're making in England compared to that of the Labour-run Wales, it just shows when Keir Starmer says he wants Wales to be the blueprint for his administration, you can look at their performance in Wales and see what that would mean for the NHS in England. And it contrasts with this week when we've announced the biggest ever expansion in the workforce training of the NHS, back with £2.4 billion.
Let's
a
get on
truly
to that.
Historic moment that gives the sustainability for the NHS.
Let's get on to that, because one of our People's panellists has asked a very legitimate question, I think. Why has it taken you so long to come up with this plan? You've been in power for 13 years.
Well, there's much we've been doing during that time. When I was last in the Parliament 5 years ago, we expanded medical undergraduate training by 25%.
Yeah,
we
but you
opened
still had a
5
massive
new
shortfall
medical
in
schools
staff.
And
you've got massive problems with retaining staff.
But Camilla, your question is why are we starting now? What I'm pointing to the fact is we did in 2018-19 expand doctor training by 25%. We opened 5 new medical schools in those parts of the country that often found it hardest to recruit. In our manifesto in 2019, we committed to 50,000 more nurses. We're on track to deliver that with 44,000 now. We also in the manifesto said we would hire more specialists into primary care, a commitment to 26,000 additional roles. Actually, we've smashed that with 29,000 now recruited, which means for patients wanting to see someone in the GP surgery, they can get access to the specialist often quicker. That frees the GP up to do those roles that only the GP can do. But it's also then about using our wider skills force in the NHS. So our Pharmacy First programme, where pharmacists will be able to prescribe 7 antibiotics for 7 different conditions, is also about saying we've got this pharmacy network which we can make more use of. So there's a lot that we're already doing.
Although some people go to
celebrate the 75th birthday.
To be fair, Mr. Barclay, I had an example from somebody I know who works at my station cafe, who went to the pharmacy, wanted to get something done to his ear, and the pharmacy then referred him back to the doctors, and then the doctor said, we haven't got time for you here, and then, of course, he ended up at A&E. That's happening the length and breadth of the country. I see it myself as a mother. When's the last time you used the NHS?
Well, my family use the NHS all the time, just like any other family. So we use the family as well. But just to take your example, you just said about pharmacy, that is exactly the point of the £600 million investment in our primary care recovery plan, which is about saying what more can we do in pharmacists, because they are much more accessible. So we are going to bring in that ability for pharmacists to prescribe antibiotics to 7 conditions, to be able to do things like blood pressure checks, to have available oral contraception, so people don't need to go and see the GP for those sort of services.
What's
That's exactly what we're rolling out. We're using the NHS app. Well, as I say, my family use the NHS. I'm father of 2 young children, like families watching this. We use the NHS in exactly the way that others do.
You have private
but the
cover
point
as
is,
well,
what we're doing is expanding our capacity. No, I don't. We are expanding the capacity within the NHS, making more of our use of pharmacy, making more of our use of additional roles in primary care. That in turn takes pressure off the GPs, and we're also looking at how we better use technology as well. So the 8 a.m. Monday morning rush, the engaged tone, using digital telephony, for example, to expand that. Online booking, using the NHS app. So we're innovating to make it easier for patients to get the right care as soon as possible, rather than necessarily everything being through the GP, and that in turn frees the GP's time up for those areas where it adds most value.
Health Secretary, I'm very grateful for your time this morning, and I'm glad to hear that your family may be watching GB News. Lovely to speak to you.